Welcome back to Voices in Health and Wellness. This is the podcast where we explore the people and ideas shaping the future of healthcare, especially at the intersection of clinical excellence, lifestyle medicine, and sustainable patient outcomes. Today, I'm joined by Dr. Seun Sowemimo, a board-certified bariatric and gastrointestinal surgeon, founder of Prime Surgic Care, and an expert in both surgical and medical weight loss, including GLP-1 therapies and lifestyle medicine. With a background that combines clinical expertise and business insight, Dr. Sowemimo brings a really valuable perspective on how we approach obesity, metabolic health, and long-term patient care in a rapidly evolving landscape. So with that, I'm sure I'd love to welcome you to the show, and thank you very much for joining me today.
Thanks for having me, Dr. Greenland. Happy to be here.
To start, would you mind sharing a little bit about your journey into bariatric surgery and what led you to build Prime Surgic Care?
Yeah. Thanks for that. I originally trained in Lagos, Nigeria, and then I took a trip to the UK, started my surgical training there. And around that time was when bariatric surgery, was starting to take hold, especially with new technology around laparoscopic surgery, which was intriguing to me. So I went into that field. And I actually didn't start out just really wanting to take care of people with weight loss. It was the technology that attracted me to it, because literally you were doing surgery on the biggest people you could find with the smallest incisions. So after getting into that, you find out that bariatric surgery in itself is not, a one fix for everything. And people still had to, eat a proper diet and everything. And I found out that what we were following, more protein, less carbs and all this, wasn't really working that well for everybody. And this hit home when I myself started to put on a few pounds and develop high cholesterol, pre-diabetes. So that is what led me down the rabbit hole of finding out what truly works for health, for wellness, for maintaining a healthy weight. And that is why my practice, Prime Surgic Care, sort of focuses not just on the surgical aspect and bariatric surgery, but the wellness aspect, the nutritional aspect, exercise, and all these other pillars that I'm sure we will get into. So that's how I got into it.
Lovely, thank you. Always good to have some background and context for what we're discussing. So tell us a bit about the practice itself, Prime Surgic Care. What does it look like today? How is it set up? And maybe talk a little bit about a typical patient journey. I know there is no such thing as a typical patient journey, but how does it look like from a patient using your service?
Yeah, so we get our patients primarily either coming to us for weight loss surgery, or they're coming to us for weight loss medications. So right now, I'm the sole physician in the practice. I'm supported by physician assistants and medical assistants. So we intake all these people, and then we're either guiding them down the path of, getting a bariatric surgery procedure or being on weight loss medications more recently. But on top of all that is what I've learned that, 20 years plus of being in this field of trying to get people healthier and lighter, all that, experience to guide them in terms of changing their lifestyle to support a healthy weight and health in general, because we get people coming in with all the usual chronic diseases, heart disease, diabetes, high cholesterol, even people finding out that they have some cancers. And the shocking thing is that these cancers are also related to lifestyle, and in a large part to what we eat, how we move, how we sleep. And that is very interesting, because all of those things coming together tie into the fact that people tell you, oh, you changed my life at the end of the day when they've come through this journey. And it is because weight and the things surrounding that affect every other aspect of life and living. So the practice is sort of set up in that way, where we're trying to sort of touch people's lives in a profound way. We also do some general surgery, hernias surgery, gallbladder surgery, but the center of the practice is around transforming people's lives around weight and health.
Thank you. Now, there's obviously been a huge shift with the GLP-1 medications. How are you seeing that impact the role of surgery in weight management from your perspective?
Well, I think there's the initial sort of excitement about GLP-1s that like it's a cure-all, but I've found that like everything else in life, to do anything properly or achieve a good result, you're going to have to do more than one thing. So it's going to, even with people on GLP-1s, it usually requires more than just the medication. But it's had an impact in as much as we've seen numbers of bariatric surgeries drop. However, we still have some people who cannot tolerate the medications. We have some people for whom access to the medication is a problem, because here in the United States, a lot of insurance is tied to employment changes, or they change the policy around the coverage for these medications, and then people find themselves, starting and stopping the medication. So there's access problems like that. And then the medications right now are more expensive, at a level that people cannot afford. And it may actually be cheaper in the long term right now to get the surgery than to have to take the medication, which for a lot of people, what people don't understand is that once you get on these medications, is not something that you do get to a certain weight and then stop the medication. You indeed have to continue the medication to maintain your weight. Got
it. So do you see the medications as as competition, in inverted commas, or more of a complementary tool? It's like, I guess because you have the more holistic approach, they're in your toolbox. But how do you view them?
Well, initially it was a competition, because once we started seeing the medications come on board, a lot of our surgery numbers started to drop, and you could see that people were asking any physician they knew, hey, do you prescribe GLP-1 medications? I'll be in church trying to, worship, and someone will be nudging me and saying, hey, Dr. Seun, do you do those medications? So it's interesting in that way. But as time has gone on, and these other factors that I mentioned have come into play, we're seeing that people are mixing both. I personally have given medication to a fair number of my patients whom, after their surgery a few years on, have started seeing some weight creep back on. Some people have used them as a complementary strategy with the surgery in people that have super morbid obesity, meaning that their BMI is so high that we know that even though surgery will have a significant impact, we would really like more weight loss to bring them back towards a normal weight. So it's becoming more of a combination now, but where exactly that balance settles actually depends on the individual and the local circumstances.
Thank you. I guess, what major shifts are you seeing in how patients approach weight today compared to a few years ago? I'm guessing the drugs are a feature of that, but I just wonder if there's any other shifts that you're seeing in their approach.
Yeah, so there's more people coming to use these tools for weight loss, because when the most powerful and effective, which is probably still the case, the most powerful and effective tool that we had was surgery, people had a barrier to use that tool. People were fearful sometimes, even though weight loss surgery is really safe, but people were fearful. So now that barrier has been lowered significantly, given that it's medications that bring people to the point that they accept the fact of doing an intervention. It's also brought along with it some people who do not necessarily qualify, due to by the standards that are set. You have people with BMIs that are close to normal and they're only slightly overweight, wanting to take the medication. People wanting to take the medication before an event or the wedding or something like that, to lose some weight to fit in a dress, that sort of thing. But by and large, it's brought more people into the fold, which is a good thing, because one of the things that I believe is we have a finite period of time that we're here as human beings. You owe it to yourself to be healthy for the most part of that and be able to do what gives you pleasure, what allows you to enjoy your life. So whether it be weight loss surgery, whether it be medications, whether it be a combination of those and lifestyle changes, I encourage people to do whatever is needed so that they're not ending up like some of my patients say, oh, I wish I had done this 10 years ago. Because there's life that they're missing on the people, simple things, even like taking a ride with your kids and at a park, that some people have to be on the sidelines and be on the outside looking in. These are interventions that can help you to get that back and get your life while you still have it, and not spend all, your best years trying to lose weight.
Thank you. So what does a typical day for you look like in practice at the moment? And I do accept that there is no such thing as a typical day, but just want to get some sense of how things pan out for you on a daily basis.
Well, I think on a daily basis, it falls into two categories. I'm either operating or I'm just seeing patients. Or on an operating day, I'm in there either doing bariatric surgery, example, the gastric sleeve, which is our most common surgical procedure, or doing some general surgery, fixing hernias, taking out diseased gallbladders. So that's a surgical day. On a clinical day like today, what I'll be doing later on, it's just early morning here, is seeing patients. I'll see a combination of new patients, offering them weight loss solutions, whether it be surgery or getting on a GLP-1, making sure that they qualify for that and telling them what the process is like. I always like to give them an overview first in terms of these are the strategies for weight loss. It always involves exercise, physical activity. It always involves dietary changes, for which I advise the patients mainly on a plant-based, with natural foods, whole foods based sort of diet. I'm a firm believer that, the diet is really central, because a lot of the information that is out there, people never tell us how much diet contributes to the problems around weight and chronic disease. So diet for me is a key one that people need to pay attention to. So I really like to try and drive that home. And then the procedure that they're trying to do, whether it be surgery or the weight loss medications, how it works and how best to prepare for it, and how to make sure that you're working in tandem with the intervention that you've chosen, rather than doing something that is against what that intervention is trying to do.
Thank you. Now, I guess it's highly complex, but can you give us a sense of how you determine whether a patient is best suited for bariatric surgery, GLP-1 therapy, or a combination of both?
Well, that's a simple one, Dr. Greenland, because most people come in and say, this is what I want. So it's a matter of trying to qualify them or making sure that they are appropriate for what they want. We live in a society, there's so much information out there. A lot of my patients come in telling me, hey, doctor, I've done my research, so this is what I want to do. So I take what they want to do and I look at their BMI, I look at their lifestyle and their profile and decide if that's appropriate for them. If it's not appropriate, then I would, introduce them to a solution that is better suited. But for most people, what they're wanting to go for is appropriate. I want to give an example. Some people, for instance, if you are more advanced in age, you have a lot of medical chronic diseases going on, and the risk of surgery is significant. Now we have, it might be easier for you to go, or safer for you to go on one of the weight loss medications to achieve the weight loss that you need.
And what about psychological readiness for surgery? How do you prepare patients psychologically?
Yeah, so part of the process, or one of the things that is prominent about the process, is a psychological review. So we do get clinical psychologists or psychiatrists to evaluate patients. And the idea is to, first of all, weed out if there is, or find out if there's any sort of pathological eating disorder that is the case with the patient. If not, then we would proceed and find out that they are an appropriate candidate, that they can follow the kind of instructions that would help them to be successful around the time of surgery and even for the long term. Thankfully, very few patients have the psychological profile that they don't qualify for the surgeries. We also do some medical tests, cardiac clearances, to make sure that from a cardiac standpoint, they're a good candidate for surgery, pulmonary as well. So that's the whole gamut of tests that we do to make sure people are ready for that sort of intervention.
Thank you. And on that note, what characteristics do your most successful bariatric patients tend to have in common, if there are some commonalities?
The people that really do well and succeed are people who are motivated, people who've tried different things and have had some limited amount of success, and people who, when they come into our program, we introduce them to some of the lifestyle changes, and between the time that they start the program and get their surgery, if they're able to apply those lifestyle changes and lose some weight, that is the best predictor that after the surgery, they're going to do very well at losing significant amount of weight.
And you talked about weight regain a little bit earlier on. I mean, what separates patients who maintain weight loss for 10 years from those who struggle to sustain the results?
Yeah. The analogy I give my patients is that the weight loss is like going on an escalator. You go from a weight that's up here to a weight that is down here on this escalator going down for a limited period of time. Typically a year to 2 years, they're actively losing weight primarily because of the procedure. While you're on that escalator, you want to be walking down the escalator. And that you do with lifestyle changes that are mainly dietary in terms of the impact, and exercise. Exercise is fantastic, but the impact on weight itself is not as much. The impact of exercise is more on keeping away chronic disease. But in any case, those lifestyle changes are like walking down that escalator so that you go down further and faster, and that you're able to keep going after you're off the escalator. So the escalator of the surgery, acts as something that multiplies your lifestyle change over a period and gets you to a lower, healthier weight. But you have to use the lifestyle changes to keep going along that journey.
And how important is ongoing follow-up after bariatric surgery? I guess it sounds like an obvious question, but I'm just interested to hear your perspective, because obviously you have a much more holistic approach.
Yeah, I think it's very important, because people are facing a tsunami of different and varying and confusing information on diet and lifestyle. So that to keep them on track, you really have to keep reinforcing this message. So for the first 2 years after someone has a bariatric surgery, we believe that we need to see them pretty frequently to keep reinforcing this message. And it's worked, because where we used to see people, have the surgery and they go and they come back and they're always telling you, I'm following the diet, I'm eating more protein and less carbs, which is not what we preach. Now, with reinforcing this constantly on our messaging, on our social media, and with patient visits, people are beginning to understand that, changing your diet, not necessarily in line with the culture that we find ourselves in modern society, but changing your diet where you're eating mostly whole foods, mostly natural foods as opposed to processed foods. Half your diet being fruits and vegetables, fresh fruits and vegetables. The other half consisting mainly of whole grains and complex starches and legumes, beans, lentils, chickpeas, and the like. And minimizing animal protein, eating a little bit of nuts and seeds. That summarizes a well-rounded, healthy diet that can help you to maintain a good, healthy weight and keep off a lot of the chronic diseases that we see out there.
So what does a long-term comprehensive care pathway look like for your patients? Obviously, the frequent visits that you've alluded to, but what else is in that kind of program to keep them where they need to be?
Well, it's just like modeling the behavior. I try to do that for my patients, with the diet, also with exercise. I bike and do some road biking during the season, and I encourage people, whatever sort of form of exercise that you can do, that you enjoy, that you do mostly in a social setting, you have people that enjoy that with you, is going to be useful for you. So over the long term, obviously we can't follow people for the rest of their lives, from a practical standpoint. So we just try and reinforce it on the front end. And as long as they keep coming back, we see patients on a yearly basis after the second year. As long as they keep coming back, we're just reinforcing these principles. We're making that they're kind of making sure that they're staying on track. And the messaging that we send out on all our channels is supporting that. A lot of our patients, are on those channels and receive our emails, our letters. So we're trying that way to kind of keep in touch. And hopefully we've already put them in communities where they know people who are adopting this sort of lifestyle. And that's something hopefully that can follow them for the long term. It all comes down to, for me, from my perspective, a lifestyle change that is enduring, and once you welded that healthy way of living into your life, you have things in your day-to-day living that makes it easy and convenient for you to follow through with this kind of lifestyle, then I think I've done my job.
Amazing. So we've been talking a lot about bariatric surgery for weight reduction, but could you speak a little bit to the metabolic benefits that are often overlooked by patients, and things like type 2 diabetes, cardiovascular risk factors? Could you speak to that a little bit?
Yes. A lot of people think that those things, the chronic diseases, follow weight and weight loss, and that is true. But in a lot of instances, it is actually not because of the weight and obesity per se. It follows more tightly with the kind of diet that we're consuming and lifestyle. And one example that I can easily describe is that when we've moved to become a society where animal products are at the center of our diet, and a lot of the animal products that we consume are manufactured in a factory kind of setting. It's called, this concentrated animal farming operations. So we're producing animals, for instance, take chicken, we produce this in the billions, and it takes a shorter time now to get a chicken of a certain weight compared to when they naturally mature. It takes about 3 months. Now we do it in about 3 weeks. That chicken is not there lifting weights and building muscles and protein. That chicken has more fat content, more saturated fat. And consuming this at the center of our diet translates into a situation where rather than our blood flow being, more fluid with water base, your blood flow has more saturated fat in it. And the places in our arteries where arteries divide is a source of friction in that flow. And the accumulation of fat in these places essentially is what leads us to heart attacks, because when it happens in the heart where the vessels divide, you can get blockage there. And it also leads to stroke, where it happens in the blood supply going to our brain, where the vessels divide and there's friction and you have more saturated fat, you have more cholesterol growth flowing through your vessels, can lead to stroke. So I've just given this example how heart disease and stroke, brain disease, can be connected because of what we're consuming and what we're eating. If you can reverse those situations by eating better, the body can heal. And this is the very basis of the American College of Lifestyle Medicine, which teaches people how to live according to 6 major pillars, which let me try and recall if I can mention them: dietary changes, exercise, good sleep, reduced stress, social connection. So these are the major pillars. And if you can turn these things around in a healthy direction, your body can actually reverse any of these chronic diseases that you may find yourself having, including obesity.
Thank you. So turning now to the business side of the practice, what's working particularly well in your practice from a business angle at the moment?
Well, from the business aspect, I mean, we've gone through a lot of major changes here in the US. I mean, we've talked about one thing, which is the coming in of the GLP-1 medications. Here they have also government regulations around practices and people receiving, bills from physician practices. There have been a lot of changes in that area. There's also been a paradigm shift in that independent practices like my own Prime Surgic Care are becoming relics of the past. And a lot of practices are being bought up either by hospital systems, large hospital systems, or the marketplace, private equity, VC firms. So there's a lot of tension there. It's become more difficult to run individual private practices like what we have. It used to be before that this was the engine of small business in the country, and but now it's becoming more corporate medicine. So that's a big challenge, and we're having to make a lot of changes, try to do some things like the big players do, and try our best in that regard, negotiating contracts with insurance companies, getting attorneys to help us with billing services and things like that. So it's been more of a struggle, but we're bracing up to the task so far.
That's really insightful. Thank you. Are there any other kind of major hurdles, roadblocks, bottlenecks that you have to face day to day or are navigating at the moment, aside from the whole corporate medicine kind of creeping in?
Yeah, it's the use of, I would say one thing along those lines is the use of technology. Everybody knows that AI is the new thing around the corner. So we're trying to see how we can leverage that to leapfrog some of these problems that we talked about that we're having. So implementing AI in a small practice that, is it's sort of a good thing, because AI has become so democratized and you have this technology that everybody can apply. So we're just trying to see where in our workflows, in terms of seeing patients, delighting the patients in the services that we have, and also running the business side of things, getting reimbursed for our services and trying to see where AI can help us in those areas. So those are the things.
Thank you. And how has your MBA influenced the way you approach healthcare and practice ownership? Because you have that sort of added business strand to your bow. And how's that influenced things?
Yeah, it's helped me to be able to assess the bigger picture of healthcare and where practices like mine fit in. So in the bigger picture, healthcare is a big industry. Billions of dollars are spent there. We talk about cost reduction, but we don't specify cost to whom that we're reducing. Is it cost to the patient? Is it cost to the insurance company? And those kind of things. We found out that there are middlemen that reap a lot of profits in the healthcare industry without giving more access, more or providing better care. So here in the U.S., especially, our healthcare is so complex, and the prices are high. So that really, my MBA helped me to open my eyes to the entire industry and the complexity of the industry along its entire value chain, and what it has personally helped me to see is where do I want to engage more in the health system, and where are the areas that I don't want to apply myself. So it's given me a bigger and better perspective of the entire healthcare industry, and it's helping shape how I make decisions.
Really helpful. So I guess your total addressable market is huge for the problems that you help patients with. If you experience a sudden influx of new patients next week, what would happen? Would anything break? Hopefully not you. What would happen?
What will happen? We will try to cope with that. I think we have some room to expand. I've had in our practice where there have been 2 surgeons, so that's an expansion slot that we can always explore. Should there be sudden unleashing of lots of patients that I can't personally handle myself or with the physician assistants that I have? So we're still at a place where I wouldn't say we're at capacity. We can take in more patients. And if that sort of situation, there's a tsunami of patients, we definitely have some means of expansion that we can explore.
And what about things like group programs, digital education, telehealth, or technology to support patients beyond the one-to-one consultations? Clearly, you can't replicate yourself for surgery, but all the other aspects of their long-term treatment program, have you thought about any of those kind of modalities?
Yeah, we've always had a presence on social media, and I believe social media is more important now. If you can get your message out there, because part of my passion is just getting out the education, especially on the nutritional or dietary piece, because as a society, we're moving more towards more processed foods, more factory farmed animals that is leading to the chronic diseases that we see. So I like to get the word out on that, not even just to patients that I might encounter, but as far as I can reach throughout the world, the entire globe. I'd like to get that message out. So I think social media is very important for that. The internet is very important for that. So we want to engage more in those spheres. A podcast like yours is important for that as well. If we can get the message out into the areas that you influence and into where you are, that's what we want to do. This is a global message that I think would help lots of people, and we have the tools with which we can communicate globally. So that's a good thing.
For sure, and anything we can do to help raise awareness and to promote your message with this, we will do. So what about the future then? How do you see the future of obesity care evolving from a business and delivery perspective going forward?
I think more of it is going to be determined by the culture, which is a factor that we often overlook. But culture drives a lot of things. It drives the messages that get out there. It drives how people actually behave, because having the knowledge sometimes is not enough. If the person opposite you on a table is eating in a certain way, the chances are that you're more likely to eat along that way. People don't want to be isolated. You know, we thrive in communities. So changing the culture in our lifestyles is very important if we're going to see the change that we desire in terms of obesity. Beyond that is the tools. It's a good thing that we're getting more tools to treat things on the back end when people have already fallen off the cliff, as it were. You know, that is a good thing, because ultimately we're all, as humans, only going to be here for a while. You need to use whatever you can to fix the problem so that you have a great life. But a lot more emphasis needs to be paid to making sure people don't fall off the cliff, to preventing the problems of obesity and the other diseases that we know are associated, the diabetes, heart disease, cancers, those sort of things. So if we are able to change the culture to prevent these things, then that's where we want to be. And I hope people across the entire spectrum of lay people, physicians, lawmakers, governments all get on board with that message, because to shift the culture, it will require everybody, along the entire spectrum of influence.
Thank you. And thinking about the future for you and Prime Surgic Care, where would you like the business to be in the next 6 to 12 months' time? Anything on the cards for you? Anything you're hoping to achieve, looking to do?
Yeah, with Prime Surgic Care, seeing more patients, offering our services, changing lives, transforming lives. I would also like to, from the business perspective, be more vertically integrated. We're thinking about, surgery center, having our own surgery center, which I think quite ambitious, as I explained to you, that, we're becoming relics as independent practices, but it's something that I would like to get into before I, hang up my scalpel and retire.
And with that, Sean, I'd love to thank you so much for joining me today. It's been such a rich and insightful conversation. So thank you for sharing a bit about what you do, what you're seeing in the space, and a little bit about the business aspects of your work. It's been really fascinating, and I'm very grateful for your time.
Thank you, Dr. Greenland. It's my pleasure.